We're extremely pleased to be able to start with Professor Grace Edwards, who's the Professor of Midwifery at the Aga Khan University in Uganda. And she is speaking from Uganda. Grace Edwards, over to you.
So as Neil said, my name is Grace Edwards. I'm Professor of Midwifery based in Uganda, but working across East Africa. Aga Khan University has 3 campuses, one in Kenya, one in Tanzania, and one in Uganda, where I'm based. But I actually work across the 3 countries. And what I'd like to do over the next 5 or 10 minutes is just give you some perspective on the effect of COVID on education for nurses and midwives in Uganda and the effect in Uganda generally. So just to tell you a little bit more about Uganda, Uganda is a landlocked country and the equator straddles the equator. So the equator is right in the middle. It's a very young population here, and they're all very keen football fans. And it's very nice for me to see that Liverpool is a favourite team, especially seeing as I'm from Liverpool originally. It's also the home of the gorillas, the mountain gorillas. There's very few of them left, but it's an amazing sight to see. And this is a picture I found of one who'd just given birth. And giving birth is a common thing in Uganda. The fertility rate is around 5.9 for women. And these are some of my students from this year. And out of a class of 23, 5 of them had babies during the course. And very different to the UK or to the West, they actually come back to work immediately. So they come back with the babies, often traveling overnight to get to school because they're so keen to learn. So this is a common sight of a picture of me holding a baby while giving a class in Uganda, which is something I like very much. Okay, now as a leader, I see my role very much as being hands-on. So in Uganda, I've always worked clinically and kept my clinical competence. So I actually work clinically in Uganda as well with the students and for my own competence as well. And the hospital I work is called Kawempe National Referral Hospital. It's the biggest hospital I've ever seen in my life. Quite a new hospital, but when you get inside, you'll see the challenges that we have here. There's around 26,000 births a year, so about 100 a day. And it was a big challenge to me when I first got here. So just to give you some idea of what it looks like inside, this is a common sight in sub-Saharan African hospitals because the facilities, although they're quite new, don't have the capacity to deal with the number of births. So about 200 women a day attend for antenatal care. And as I said, about 100 deliveries a day. So it's really, really busy. And as you can see, social distancing, it would be very difficult here. This is the neonatal unit, which is always around 300% over-occupied. So we have to make do with whatever we can in order to look after the babies as well as it can be done here. Now, the government response to COVID here was very swift because they realised that a COVID outbreak on the size and scale of what's happened in the West would be very, very dangerous here. So we had a complete border lockdown from the middle of March. So even before the first case was identified here. And we had no private cars. We weren't allowed to drive, no public transport. The airport's now been closed for about 6 months. And we started off with a curfew from 5 till 7 a.m. Now it went to 7 p.m. to 7 a.m. And just this last week, it's gone till 9 p.m., which has really made a difference in being able to walk around and be out. What the government did here was make it a criminal offence not to wear a mask. You actually can get 6 months in prison. So it's a very interesting difference to some of the things I'm hearing from the West. But unfortunately, the universities and schools have also been closed for about 5 months. Now, this work by Bell gives you some idea of what the impact of COVID would have, particularly on maternal mortality here. Today, we've just gone over the 3,000 cases, so still relatively small number of cases with 30 deaths. But when you look at the effects of the lockdown and COVID on maternity mortality particularly, it's a big challenge. So there's only 1 ICU bed for 1 million of the population here. And before COVID, the maternal mortality was 336 per 100,000 births. What we found is one of the big pressures we have is to try and encourage women to deliver within a hospital facility so that we at least have the facilities to look after them and they're not delivering with an untrained birth attendant. But we've seen a reduction of 29% of facility deliveries in March compared with January of this year. And that's around 28% less facility deliveries for the 12-month average for 2019. The other worrying thing we found is an 82% increase in maternal mortality, which went up from 92 deaths to 167 deaths over the same period from around about March, which was an increase of 87% from the 12 months from last year, which is really worrying. One of the challenges we have here is transport, and this is some pictures of mobile ambulances that are used, particularly in the rural areas, to try and get women to a facility if we can do so. But again, it's been very, very difficult. Okay, so from my perspective as a leader, I'm very keen that if we're not building leaders, then we're not leading, you're following. So what I'm trying to do here, or what my aspirations are, is to help develop some very, very good midwives, some of the best student midwives I've ever worked with in my life, because they're so committed to learn and so committed to work and to develop. And they've all been working clinically throughout COVID, as well as working online with school. So I think it's very much about inspiring the students that we have here. And just to finish, this is a picture of my first group of students, and 4 of these had babies throughout the course. And every single one of these groups are now in a leadership position. So hopefully they're going to be able to develop midwifery and develop care for women, particularly under these challenging circumstances. So how we've responded to COVID as a university, the university is still closed. So we're actually doing all our Zoom lessons online. And one of the challenges we have for the students is they can't afford to buy data. So the university buys all students' data bundles so they can access online discussions. We use WhatsApp as a discussion forum, and we also use an online platform called Moodle, which everything is pasted on, all the talks, all the discussions, all the papers are pasted onto there so students can access them. We're still not allowed to do any clinical teaching because the hospitals are all under strict quarantine. But we've all been trained on inline teaching and assessment, and I'm now becoming an expert at teaching on Zoom, although I couldn't get my slides up. But it's been a great challenge. Okay, so thank you, and I'll be welcome to hear some questions from you.